If you're feeling overwhelmed with the intake forms and the insurance code, you're in what's called the logistics fog. Today I'm giving you the blueprint to clear that fog and to get you to your surgery date. Let's dive in. So first I'm going to go through the intake process. So the first thing that they're going to have you do is they're going to have you fill out an intake form. So that's going to have your demographic information, that's going to have your transition history, your medical history, and also what donor site you're thinking of. Next, they're going to do a quick insurance check. So pretty much what they're doing is making sure that you have gender affirming care coverage and then what the insurance requires. So insurance will vary quite a bit. Some insurances cover all of it, some insurance covers half, some insurance doesn't cover any. This is going to depend on where you've gotten your insurance. So if it's through your employer, if it's through like a marketplace, and it's going to vary depending on what state you're in. So some states have laws and protections against this stuff and some states do not. Next, they're going to want you to submit the required documents. So this is usually 1 to 2 letters from a mental health care provider, 1 letter from your PCP or your HRT provider. This will also vary by state and insurance plan. So next you will register as a new patient and you most likely will set up what they call a patient portal. So a patient portal is where you'll receive messages, you'll do virtual appointments, you'll have post-op instructions, and they'll just kind of give you general updates. So the next thing after you do all this, a coordinator or a social worker from that clinic will contact you and they will let you know what you need to do to schedule a consult. So a lot of clinics will have certain criteria that you have to meet before you can schedule a consult. A big one is a BMI. So your BMI needs to be 32 or lower at most clinics. This, of course, will vary. And then the other thing, if you have any health conditions, those need to be stable and managed. And you also need to be able to undergo anesthesia safely. So next is the actual consult. So first they're going to go through everything that you put on the intake form. So your medical history, your transition history, all that stuff, your health conditions, just to make sure that you're a good candidate. Next, they're going to go through your goals and priorities with this surgery. And then they're also going to go through the procedure details. So what donor site you're thinking, what the stages look like for that particular surgeon, the risks, and if you're just an overall good candidate. They will also go through their wait times. So each clinic is going to vary depending on how busy they are. And then also they will go through your general recovery and lodging options and travel and that type of stuff. Next, you will be able to ask questions. So you can ask questions about the hospital stay, the care that's needed, and stuff like that. And also I will provide a checklist in the deep water Phalloplasty recovery system that I'm launching this fall. So be on the lookout for that. So after the consultation, they will give you a big info packet and they're going to go through some pre-surgery stuff that needs to be done. So like blood work, your required letters, if you smoke, the stop smoking requirements, and then you most likely will meet with a social worker or a coordinator and they will kind of go over your recovery planning and your lodging and the emotional support and just kind of answer any questions that you might have. So after the consult, if you decide to move forward with that surgeon, they will go over insurance stuff with you and your hair removal plan and the just general scheduling. So there's a couple things that need to happen before you can actually schedule surgery. So you do need a prior approval from your insurance first, and this could take weeks or months. And they will also, if your insurance doesn't cover the whole thing, they will discuss kind of other financial options that you might have. And then they will put you on what they call the ready to schedule list. And so just be aware that this might be a long wait before they can actually call you and give you a date. And you can also, a trick, you can actually message your team for updates on like where you are on that list and kind of give you an estimate of when surgery will be. I highly suggest that you get on their cancellation list because you never know, you might get a cancellation. And actually this happened to me for my stage 1 and stage 2 and I was moved way up. So just remember to be on the cancellation list. So some general wait times. It's going to vary, of course, from surgeon to surgeon. So pretty much when you schedule your consult to when you have your consult could actually be years. It depends on the clinic. It could be 3 to 4 years. It could be a couple of years. Like I said, it just depends. So once you get your consult, it's probably going to be 1 to 2 years just to get surgery. So this is a very long process. So just kind of be aware of that. Like I said, each clinic varies on their wait times. And then wait times between stages can be long as well, depending on how backed up your surgeon is. So between stage 1 and stage 2, ideally they'd like to get you in between 5 to 6 months, but sometimes surgeons are so busy that they can't, and it could be up to a year. So just kind of keep that in mind, that you could be in between stages for an extended amount of time. And then stage 3, between stage 2 and stage 3, it should be a little bit less, depending on if a different surgeon does the stage 3. So in my case, a different surgeon does stage 3, and he is not as backed up, so it shouldn't be as long. They do like you to wait a year from stage 1 to get stage 3, so just kind of keep that in mind too. And they will usually schedule surgery within 4 to 6 months in advance, just so you have some planning. But if you do get a cancellation, it definitely could be sooner. So it could be, only a 4-week notice. So just kind of keep that in mind to make sure that you're ready to roll. So some helpful things to do while you're waiting to get surgery scheduled is work on your electrolysis, because that takes a long time. That can take up to 12 months, maybe even more for people who have more hair. And then you can take that time to save money, because this is a very big financial burden on most people. And then you can also work on your health, so you can get physically fit and make sure you're eating healthy, because that does help with recovery. So logistics are just the map. The surgery is the final destination. To make it easier, I've put together a free stage 1 to stage 3 supply list. So that's down in the description below to help you out. And if you want the full roadmap for this journey, join the Deepwater waitlist while you're there. And so that is my full Phalloplasty recovery system. So that is coming this fall. So the waitlist is down below. Stay steady, and I'll see you in the next one.